Welcome, everyone.
Thank you for joining us today. I'm Teresa Marantet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Please be reminded that public health measures continue to be the most important protection to prevent the spread of COVID-19. Stay home if you are sick, maintain a 2-meter distance from others, wash your hands often with soap and water or use an alcohol-based hand sanitizer, use proper respiratory etiquette by coughing into a tissue or your sleeve, and wear a mask when attending commercial establishments. For area businesses, visit our website to access our Safe Return to Business Toolkit. I will now report our current case counts. There are 106,167 confirmed cases of COVID-19 in Canada and 36,061 cases in Ontario. Chatham-Kent has 162 cases and Sarnia-Lambton has reported 286 cases. Michigan now has 66,627 cases with 11,752 cases being in Detroit. Today we are reporting 1,725 cases of COVID-19 in our community, an increase of 47 cases from yesterday. 45 of the 47 new cases are workers in the agri-farm sector. 1 is a healthcare worker and 1 is still under investigation. 1,102 cases have now resolved. 482 people are self-isolating. 26% of our cases are between the ages of 20 and 29 years. 23% are between the ages of 30 and 39, and 17% are between the ages of 40 and 49 years. 64% are male and 35% are female, with 1% unknown at this time. Our community has lost a total of 68 people to COVID. 49 deaths have occurred among residents in long-term care and retirement homes. There are 3 long-term care and retirement homes experiencing a COVID-19 outbreak, and there are currently 4 workplaces in the agriculture sector and 1 workplace in the manufacturing sector experiencing a COVID-19 outbreak. Symptoms of COVID-19 can range from mild to severe. Some common symptoms include a fever, a new or worsening cough, a barking cough, chills, sore throat, and shortness of breath. Call 911 if you have difficulty breathing and are struggling to breathe or speak, or are experiencing severe chest pain, if you are feeling confused or losing consciousness. Please be advised that Windsor-Essex has 2 COVID assessment and testing centers, Erie Shores Healthcare in Leamington and Windsor Regional Hospital, Olette Campus. SOHAC in Windsor also offers testing for First Nations, Métis, and Inuit people and their families. Please continue to visit our website at wechu.org for the most current information and case counts. I will now turn it over to Dr. Ahmed, our Medical Officer of Health, for further updates on COVID-19.
Good morning, and thank you for joining us. We continue to receive a considerable amount of calls related to our mask order. Some are clarification, majority are complaints for businesses that are either not enforcing the order or businesses that may be interpreting the order incorrectly. Please note that we follow up on all complaints we receive by contacting business either by phone or in person to provide education. Masks are required under the current order for all commercial businesses. Please note that there are exceptions for individuals under the order, including small children and those with certain medical conditions. We ask that businesses work with individuals to accommodate their needs appropriately. There is no requirement under the order for individuals to produce a doctor's note. We also continue to receive a number of calls for people asking test results. At this time, the Windsor-Essex County Health Unit is only calling individuals who have a positive test results. If your results are negative, the Windsor-Essex County Health Unit will not be calling you and you may not have your test results on hand. Individuals in these circumstances can access their results online by going to www.wechu.org and clicking on the tab View Your Test Results. This will take you to the Government of Ontario online test results portal. If you are unable to access your results online, please contact the place where you've received your test. If you were tested at one of the 2 local COVID-19 assessment centers, please contact the assessment centers directly for your results. If you were tested through your primary care provider, please contact your primary care provider for your results. I know this can be a stressful time, and especially for those awaiting results. I can assure you that if your results are positive, the VICI will contact you immediately after receiving the results. The current turnaround time for receiving a result is approximately between 2 and 4 days, and it can be longer. But rest assured that if your test results are positive, the VICI will immediately notify you the moment they receive the test results. Thank you.
The conference is now unmuted.
We'll now take questions from the media. We'll start with AMA 100.
I have a few questions for today, but obviously I'll ask my first two. When it comes to the masks, Dr. Ahmed, is it time that enforcement will step up? I know you mentioned education, but when will enforcement step up? Could we see businesses that are not following it be fined or penalized?
Yeah, that's the intention, that we use all the education tool to support the businesses to have all these things in place, but recognizing that there are some implication and some penalties that can be assigned to the businesses if they fail to address or fail to take any measures. The key pieces here is we all have to do our part as individuals who are visiting those commercial establishments, and also as the businesses, to ensure that they are doing their part in enforcing it. And we are doing all of those education, but if it continues to become a challenge with the businesses not enforcing it or not even trying to enforce it, there will be penalties and fines.
And then for today's cases, two-part question, but the first one's very short. The healthcare worker, is that a worker that works in the States?
Today, the healthcare worker is someone who works locally.
And then the 45 agri-food sector, is that all at one farm or is that at multiple farms?
It's at 2 different farms, but those farms already have cases, so that's why the number of new farms has not increased.
Okay, thank you. I have a couple more, but if we have time, I'll ask them after.
Okay. Any questions from Windsor-Essex?
Do you happen to know if the 45 new cases among agri-farm workers, if they were asymptomatic or if they were showing symptoms?
Well, they were all close contacts of the symptomatic cases, so by default, they were high risks of contacting the disease. And that's what happened. We tested them, and they all came back positive, or majority of them came back positive. So we're monitoring them, and they're already under isolation at this point.
Are you concerned about the prevalence of, still yet uncovered cases among agri-farm workers?
Well, the biggest challenge, what we have been identifying right from the beginning of this pandemic, especially in this worker, is the living arrangements and the accommodation that these workers live in. Once you have a positive case, it's very easy to spread it to pretty much everyone who lives in the same bunkhouse or in the same accommodation. So the key approach has always been to prevent any introduction of this case in any of these farms. So some of the farms, when they had a case, they're seeing a substantial increase in the number of cases, and the number is growing. But for farms that were tested, some of them have no cases at all. So I think there's a good mix right now. But as far as we're looking at the outbreaks that we are dealing with, these continues to happen in the farms that are already known to us with cases. And all the efforts are directed to ensure that it doesn't spread further. We are also getting some of these follow-ups from new farms that have symptomatic cases, and then they're also being investigated. So it's a combination of both that we are using to ensure that we're containing the disease as quickly as possible once we find it.
Thank you.
Any questions from the Windsor Star?
Not at the moment, thank you.
Any questions from CTV?
Yeah, good morning, Doc. Just picking up on Rob Hindy and the masks. You're talking about finding businesses, but I'm curious, what about the anti-mask wearers? Because I've gone to stores and I've talked to, I talk people up, and the people that work there say there are people who just walk in the store and don't wear a mask. So what do you do with those people? What's your advice to them?
So I think my advice to everyone is we all have a part to play, and I can recognize that there are people who may have some genuine reason, medical reason, or any other reason not to wear it. But for everyone else, I think it is important that we have to do our part, and we need to contribute to limiting the spread as much as possible. And there's a lot of evidence now, and it's pretty much the entire province is moving in that direction. Individually, our health unit was the second health unit in the province to make this mask order, but as we are seeing pretty much everywhere else, it's coming. So I think overall, as a behavior change, it's a good tool to know what you're expected to and how you should be playing your part in reducing the spread of the disease. So I would request everyone to take that as in a positive sense, and playing their part in the social construct and ensuring that we are all doing our part to limit the spread of COVID-19.
But it's not like they can get fined or anything either, right? It's more or less a moral thing, I guess, right?
Well, for the individuals at this point, yes, but in some cities and some municipalities, what they have done is they have used this order to draft bylaws for the specific municipalities and started some enforcement in that regard. So there is this opportunity for the municipalities to maybe think more closely about how we can maybe take it to a next level and have those kind of bylaws in place. The challenge continues to be the same, Bob, is if you are a business and you have seen someone, and then even if you're reporting it to the health unit or if the law enforcement agencies, how quickly someone can get there and maybe get some information or maybe issue some fine. So enforcement is a challenge, and I think that's why we want to use the education approach to help them understand, because clearly in the pandemic, if people are not doing their part, enforcement cannot do everything. It has to be us. We have to take our own responsibility as individuals. We have to take responsibility as the business. And look what we are seeing in the United States right now with the explosion of cases when people are not following physical distancing, not wearing the mask, and look at the number there and look at the number in Canada. We have done an amazing job. I think we just need to move forward, and we need to take that responsibility, our individual responsibility as well as social responsibility, to keep doing our part in reducing the spread of COVID-19.
Okay, that's great. Thank you, Dr. Ahmed.
Any questions from CBC?
Yes, good morning. So these new cases are from farms that are already expected under outbreak. I'm just wondering if there's any indication of the spread. Is it happening on the job, or is it happening in worker accommodations?
Well, it has always been happening at the accommodation, because all of these workers, the close contact that you're identifying and finding cases, they're all from the same accommodation, and that has been the concern. Throughout the pandemic, we have always said that, reduce the number of contacts, even when we're talking about not meeting more than 5 people or not meeting more than 10 people. And the whole idea is to put some restrictions if you have a case, how quickly you can contain it. Unfortunately, because of the living condition and congregate living settings, each of these individuals have a close contact of between 15 and 20. On an average, 12 to 13 is the average number that we are seeing. So that automatically puts them at a disadvantage of having a large number of contacts, and one case can easily result in either infecting all of them or a majority of them. So I think that's why the challenge has been to focus more on the prevention side and to ensure that it doesn't get into that population to begin with. And once it starts, it's very difficult to contain it because of their close living arrangement. And that's why we are seeing all these challenges with the isolation and everything that we are trying to do right now.
If the outbreaks on these farms were known, why weren't these individuals self-isolating already?
They were self-isolating already, and that's why it's just based on the positive that we are seeing right now. The exposure already happened, and then when they were identified as close contacts, they were immediately removed from their accommodation and were isolating. And during that time, if they start to develop symptoms, then they are swabbed again. So that's what happened. And now majority of them are coming back positive, or a good number of them are coming back positive. We cannot go back in time. Yeah, so just to add last part, we cannot go back in time and prevent the exposure, and that's where we're saying that the exposure piece is immediate notification, and if anyone develops symptoms, and if they can be removed immediately, the close contacts identified, removed immediately, that's the best way we can contain it.
Thank you.
Any questions from Blackburn?
No, I think they've all been covered. Thanks.
Any further questions from AM800?
Yes, I think this is more for Teresa than Dr. Ahmed, but we're reporting today that QP is investigating a possible confidentiality breach at Eiler Lodge with the health unit involving an employee. Teresa, can you expand on that? What happened there?
Actually, Teresa stepped away, Rob, so can we move on to the next question, and then I can get back to you?
Yeah, that works. So I'm good then. Thank you.
Okay. Any further questions from Windsorite?
No, thanks.
Windsor Star?
No, thank you.
CTV?
Yeah, just one quick one here. Just going back to the test results. I know you said 2 to 4 days, Doc. What is the threshold for somebody that's sitting around waiting? Like, are we talking 7 days tops, and then they should start to go, well, maybe I should call? Or do we just leave it because they haven't heard?
Well, I guess they can obviously go online and check the results. Most of the labs that are currently operating, they have the ability to post the results online. And again, it depends on the day when the testing has happened. 7 days could be a good threshold, that if you do not have the results by 7 days, I think it may be a good idea to connect with the healthcare provider or the location where you have got your testing done, and then just work through them to identify what your test results are. But majority of the cases, the negatives getting the posting can be delayed, but the positives are immediately notified and posted, and healthcare providers, either it's the health unit or your primary care provider, we will both try to connect with you as soon as possible to notify you of the results.
Okay, that's great. Thanks. Have a good day.
Any further questions from CBC?
No, thank you.
Blackburn?
No, thanks.
Hey, thank you, everyone. Have a good day.
You too. Thank you.